Thank you, Bill. I forgot to mention that we're going to do all of the speakers, and then we're going to take a break, and then we'll come back and open it up for questions. So note your questions as we're going forward. Our next presenter, Richard Doerflinger, the Deputy Director for the Secretariat for Pro-Life Activities from the United States Catholic Conference of Bishops. Richard's worked there, I think, longer than I have, over 30 years. Richard and I have been colleagues. Among his duties is the preparation of policy statements, congressional testimony on abortion, euthanasia, embryo research, human cloning, and other medical moral issues for the Bishops' Conference. Also an adjunct fellow in bioethics and public policy at the National Catholic Bioethics Center in Boston, and serves on the advisory board of the Center for Bioethics and Human Dignity in Illinois. He's testified before Congress, as mentioned, the National Bioethics Advisory Commission, the National Institutes of Health, the President's Council on Bioethics, and several state legislatures on ethical issues involving human embryo research and cloning. He's spoken and published widely, too many to mention here, I'm not going to bore you with those. He's contributed to a number of different books, two new ones coming out, Stem Cell Research, New Frontiers in Science and Ethics, and one called Human Dignity in a Biotech Century, edited by Charles Colson and Nigel Cameron. He holds a BA degree and an MA in Divinity from the University of Chicago and conducted doctoral studies in theology at that institution in the Catholic University of America. Richard is also, I think most of us are so excited about the fact that he was the first ever recipient of the Evangelium Vitae Award from Notre Dame in 2010. Little known to most people is Richard, I think, actually wrote the Weldon Amendment. Isn't that correct, Richard? He actually wrote the Weldon Amendment, which is one of the benchmarks in federal law. He's certainly an expert in most of these areas. My colleagues and I, in the state Catholic conferences, whenever we're struggling with one of these issues, it inevitably comes up. Why don't we ask Richard? Let's ask Richard.
You know, I got to get you a newer bio. The NCBC is in Philadelphia now.
And you send it.
I got to eliminate that file. Let me start with a couple of disclaimers, because there's a lot of text here, which I'm not going to read because it would take us much too long. But we have the outlines at your places. And we also have on the website of the Bishops' Conference a document called, you can just search with Google on this phrase. This fact sheet is called Current Federal Laws Protecting Conscience Rights. And it's not even totally comprehensive, but it has a lot more laws than these. I'm talking here about sort of the three big ones. But if you look at it, you'll be astonished that throughout federal law, through Republican as well as Democratic administrations, we've had many laws passed recognizing and respecting conscience. It is only very recently that it has suddenly become controversial to recognize conscience and allow diversity and allow Catholic and other pro-life healthcare providers to function fully in the healthcare system. And among other things, and I use this sometimes as an example of how far we have fallen, if you look, it's a chronological list, if you look under 1999, you will find that there's a conscience clause in the federal employees' health insurance program, health benefits program, that allows any issuer of insurance to offer a plan to federal employees that excludes contraception if the insurance issuer has a religious objection. There's no definition, there's no narrow definition of what kind of issuer that has to be and so on. In fact, originally the law actually listed three specific Catholic health plans that were exempt, and then said, and any other issuer that has a religious objection. I was giving a talk on this topic a few weeks ago, and a congressional staffer who's Catholic came up to me and said he's so grateful that he's able, as a federal employee, to go in and buy a health plan that does not include family planning methods that are against Catholic teaching. Federal employee. And now we have the federal government saying we can't offer such a health plan even to our own employees in the church. That's how far we've come in just 12 years. So, I want to give you some reason for hope, because we do have a very good body of law here That body of law also has some flaws and loopholes that need to be fixed, and we have some new threats that we need to address through new legislation as well as other action. So, just again, very briefly, I'm not going to read all this, but the first of these is the Church Amendment. It's not named for the Catholic Church. It's named for Senator Frank Church of Idaho. It was approved in 1973 in its original form because of two threats. One was Roe v. Wade itself, legalizing abortion, and the pro-abortion groups at that time started saying this is such a fundamental right that even conscience laws allowing people not to take part in abortion in order to function in the healthcare system are now unconstitutional, are now out of the, they're off the table. And Congress had to respond to that and say, no, people still have rights. And the other thing that happened that people don't know as much is there had been a recent federal district court decision in Montana saying that a Catholic hospital, because it received federal funds and was the only major health provider in that part of Montana, had to do sterilizations for anyone who wanted a sterilization, or a doctor who wanted to use the facilities for that. So from the very beginning in 1973, these debates went beyond abortion into sterilization and contraception as well. And the Church Amendment has several provisions. Again, I'm not going to go into great detail, but some of them are very interesting. For example, and subsection B is the one that's a direct response to the Montana sterilization case, that the fact that you receive federal funds under various federal health programs cannot be used by a court or other public authority to make you take part in abortion and sterilization against your moral or religious convictions. This is also a steady theme throughout this whole history of conscience law, that there was respect for both religious and moral convictions. That's not a new thing, that's always been the case. Subsection C talked about the rights of physicians and nurses and employees, that they can't be denied privileges or employment, and because of their willingness or unwillingness to do abortion and sterilization. Now that willingness clause was added by, I think it was Senator Javis and Senator Ted Kennedy during the legislative process. We didn't want that in there. It ended up becoming a sine qua non for the law to pass at all. So it does protect the right of a doctor who is willing to perform abortions as well. And I cite that because sometimes Catholic hospitals are criticized because you might find that someone in their OBGYN department is someone who performs abortions elsewhere, and that's a scandal for the church. The problem is that the federal law protects that doctor from being excluded from the hospital's privileges and so on because he does abortions elsewhere. They can keep him from doing them there, but they can't keep him off the staff because of his willingness to do them elsewhere. So this law, the Church Amendment, became double-edged. And another part of subsection C actually was completely open-ended. It said, if you're receiving federal grants for biomedical or behavioral research, you can't discriminate against healthcare personnel because of their refusal on moral or religious grounds to engage in any health service or research activity. So that was completely without restriction in terms of what the procedure is that people are objecting to. Subsection D, and this has to do with that same kind of open-ended performance in any health service or research activity in a program administered by the Secretariat of Health and Human Services. You have to respect that individual's conscience. So this is very, potentially very broad. It has some of the deficiencies Bill Cox mentioned earlier, and I'll go through those again too, about why is this not more effective than it is. The second law I want to talk about is called the Code Snow Amendment. It was passed in 1996 because the Accreditation Council for Graduate Medical Education, a private organization with membership from AMA and ACOG and the American Association of Medical Colleges, was putting forward a policy that all OBGYN training programs had to provide residency training in abortion. And this law basically said that no federal program, no state or local government receiving federal funds can discriminate against a program that doesn't do abortion training under these circumstances, and can't discriminate against the graduates of it And in fact, in terms of what it meant was in terms of accreditation as recognized by the federal government and other governmental bodies, and in terms of, therefore, access to federal and state funds for their program, that abortion requirement has to be treated as null and void. And those that do not provide abortion or abortion training have to be treated as accredited. That was actually also the basis for the Hyde-Weldon Amendment, which took this a step farther and said federal, state, local governments can't discriminate against institutional or individual healthcare providers who won't get involved in abortion or abortion referrals outside the training context. So it covers much more broadly. But the Hyde-Weldon Amendment, which was first passed in 2004 and has been reapproved without change every year since as part of the appropriations process, because it's an appropriations rider, it has some drawbacks and some difficulties, which I'll mention. This was named, of course, for Henry Hyde. This was added as an additional provision to the annual Hyde Amendment against federal funding of abortion, and Dr. Dave Weldon, congressman from Florida. And that's the text of the Hyde-Weldon Amendment. It means that you cannot be discriminated against by a governmental body. Now, it doesn't ban private discrimination. It doesn't help you in an employment dispute with your private employer, for example, as a hospital or clinic. But it does say that state, federal, local government, those governments receiving federal funds, and generally they do, cannot discriminate against you because you as an individual, or your institution, or your health maintenance organization, your health plan won't cover, perform, refer for, make arrangements for abortion. And these laws are all things that every Catholic doctor and hospital in the country, I think, needs to know about and needs to be very much aware of, to be aware of the rights they have in the current law. When I say the full text of these and other conscience laws are available at those websites. The easiest thing probably though to do is just do a search on current federal laws protecting conscience rights. There's also a broader website called USCCB.org/conscience, which has this and many, many other things, including some of our recent battles we're involved in with the federal government now, and some opportunities to write into Congress, and soon there'll be another opportunity to write into the Secretariat of HHS. And yet there are these threats. There's ACOG, the American College of Obstetricians and Gynecologists, came out in 2007 with an ethics committee opinion that is extremely restrictive on conscientious objection. It's not an opinion about conscientious objection, it's about an opinion on the limits of conscientious objection. And the limits are, you can say you won't provide abortions, but then you still have to refer for them, and you have to, it would be a really good idea if you located your practice very near an abortion provider to make sure that when you do those referrals, they just have to walk across the street. So you don't have to perform them, you just have to facilitate, actively promote them. Worthless. And yet they've refused to back down on this. The fear of many Catholic doctors and others is that this ACOG opinion will get incorporated into the accreditation standards of the American Board of OBGYN, ABOG, and who often follow ACOG's determinations. And at that point, it becomes literally impossible to act as a pro-life physician and be an OBGYN. That has not happened. I think that the fact that the Bush administration reacted so firmly to this and issued new enforcement regulations for these existing conscience laws and put up a fight is a reason why it did not, so far, come to that. But there continue to also be cases in various hospitals, most often, interestingly, involving nurses who are being demanded to receive abortion training or to get involved in abortions directly. Mount Sinai Hospital in New York, Vanderbilt University, the University of Medicine and Dentistry of New Jersey, which is a state-owned facility. It's run by the state legislature, and therefore people are able to invoke not only the Church Amendment, but also the Hyde-Weldon Amendment. And in some of these cases, when the good people at Alliance Defense Fund and elsewhere have filed complaints with the Department of Health and Human Services Office of Civil Rights. They have backed down to some extent. Though the Mount Sinai case involving Nurse DiCarlo, that's an especially grisly case of a nurse who, against her Catholic moral and religious convictions, was forced to help take part in a late-term abortion. She was assigned to be the person who puts the parts back together to make sure they got all the parts of the baby. And she has filed a complaint with HHS. I think it's now been 2 years, and they are still investigating. She has had no recourse, and an appellate court has said that because there's nothing in that statute that says you have a right to go to court to get direct vindication of your rights, there's no such right that she has. She has to go to HHS, which unfortunately is becoming more and more one of the major perpetrators of threats to conscience these days. Bill Cox already talked about the efforts in California to force Catholic managed care plans to cover abortion and the human trafficking grant. We now have, in the human trafficking program, not only did we get kicked out of being able to provide services to those victims by the Obama administration, but just 1 week ago, literally in the dead of night, 9 p.m. on a Friday, a federal district judge in Boston issued an opinion saying that when the Bush administration and at first the Obama administration was allowing the Catholic agency to run that program without making rules for abortion, they were guilty of an unconstitutional establishment of religion by letting the Catholic Church run this program in a way that did not violate its values. And now we have to appeal that decision. Fortunately, though the suit was against the federal government for letting us do this, we intervened and became a party to the suit as well, so that now even if the federal government does not appeal, we can, and we're going to be doing so. But that's actually gotten even worse. The judge basically bought hook, line, and sinker the ACLU argument, which is that if you allow religious institutions to participate in public programs without violating their principles, you're establishing that religion, and that's unconstitutional. Free exercise equals unconstitutional establishment. And of course, the biggest recent threats come from the new healthcare reform law. We have a situation now in which those who enroll in most health plans, not all, because there's a clause saying each healthcare exchange has to have one plan that doesn't have abortions, that doesn't have elective abortions. But most plans, of course, choose to have abortions. They think it saves them money. Kids, live kids are more expensive than dead kids. Until Social Security goes out of business, right? 20 years later. But in the short term, it's cheaper. So when those plans do decide to cover abortion, the federal government moves in and says, we will provide federal tax credits to support that plan that has abortions. And by the way, you may not allow any enrollee to opt out of the abortion coverage. And this is something the federal government is adding. It's not just acknowledging the current situation, it's actually making things worse by saying, when somebody enrolls in such a plan, every enrollee, every beneficiary, man, woman, and child, their premiums all have to go toward abortion, and we're going to do a little accounting exercise where the abortion money comes out of each of their premiums, so that we can claim there's no tax funding of abortion here. But it's a mandate, it's a coerced premium payment for abortion. So how is that a comfort to the people being forced to do it? The whole Healthcare Reform Act is not covered by Hyde-Weldon, because Hyde-Weldon covers appropriated funds that come out of the Labor HHS appropriations bill. And this act did a lot of appropriating of billions of dollars that bypass the Labor HHS appropriations bill. We had the Hyde-Weldon amendment applied to this through the Stupak amendment in the House and the Hatch-Nelson-Casey amendment in the Senate, but those were taken out of the bill. There is a conscience clause in the law now. It says health plans may not discriminate against providers in the plan that won't do abortions. But there's no guarantee against the government discriminating against those providers and even against entire health plans. And then we have the essential health benefits and preventive services list that have become so public now. Essential health benefits that required of all plans in these state exchanges has not been defined to include abortion. In fact, we did manage to get language in the Health Care Act that says you cannot require abortion. At least you can't require what the federal government is willing to call an abortion in the essential health benefits. But late in the game, this new list of preventive services for things that must be covered without copay was added, and that preventive services list is not amended by that language. So theoretically, under preventive services, you could have even surgical abortions as a preventive service to prevent the burdens of having an unwanted child. But what preventive services list has been interpreted by HHS to do, of course, is to cover all methods of contraception approved by the FDA, which happens to include at least one drug, Ella, that I think clearly can be used to do abortions, and a number of other drugs such as Plan B that are prescribed as morning after pills, but certainly there's serious medical literature saying those can at least prevent implantation and lead to the death of the newly conceived embryo, which is an abortion in our moral standpoint. And this is going to apply to virtually all private plans negotiated after August 1st of this year. You can get out of it for a while by having a grandfathered plan, by not changing your own health plan that you currently have, but ultimately those will have to comply as well, because there are all these other requirements under the healthcare reform law you're ultimately going to have to make changes to accommodate, and then you'll be hit by this requirement as well. How sweeping is it? It's certainly unprecedented in federal. There's no federal law now that places this kind of mandate on private health plans. And as I mentioned, even those places where you did have a mandate for contraception and plans for federal employees has a pretty broad religious exemption and a religious and moral exemption for any individual provider practicing in the plans that do have contraception. It's broader than any state contraceptive mandate. As Ned mentioned, the narrow religious exemption in this law was taken from the California law, which was written by the ACLU. But the scope of the underlying mandate is much broader. It covers self-insured plans. It covers plans you might try to do that evade the state contraceptive mandate in various ways. Because most of the state contraceptive mandates say if you do prescription drug coverage, you have to do prescription contraceptives. Most of them don't even mention sterilization. This does cover sterilization, and it's not restricted to plans that have prescription drug coverage. It is almost completely inescapable. The religious exemption has 4 parts, and the one that has gotten the most attention is that you are not a religious organization or a religious employer under this exemption if you dare to serve any people who are not of your own religion. So this makes you non-religious. It makes Mother Teresa secular because she sees Christ in even the Hindus and atheists whose lives she has saved and who she has picked up off the streets of Calcutta. It is an absurd and insane definition. We have also said, I think I might have been one of the first people to say this, Jesus himself is not religious under this definition. He went around healing Roman centurion servants and so on. You know, God knows what religion they were. So this is intended basically to say, and it was even mentioned in the original HHS rule, that what this is trying to do is respect the unique relationship between a house of worship and its employees in ministerial positions. Now that's even narrower than what the rule really does, but it indicates the mentality here. You have a freedom of worship. You may stay in your sanctuary and pray. You simply may not act on your religion. The vast majority of religious organizations, and certainly any of those who are charitable, healthcare, social services organizations that serve the poor and needy, regardless of their religion, are out of the cold. What they get is second-class status. They get delayed enforcement for 1 year, and after that, they are going to have the great gift that they will not have to put into their health plan these objectionable services. It will be done for them. Isn't that reassuring? It'll be done either by the insurer, or somebody said, well, what about a self-insured plan where the insurer and the employer are the same person? They'll say, they're now proposing, we will allow other nonprofit organizations to volunteer for the privilege of putting this into your employees' plans. Your health plan will be run by Planned Parenthood if you work for the Catholic Church. Thank you, Obama administration. There's no protection at all for the people I call third-class citizens, and that is all of us. Individuals, people who work for secular organizations or who might run an organization that is not church affiliate, but which you want to be able to run by your own values. That's all of us. We're third class. We don't even get the one-year delay or the privilege of having the coverage forced on our employees around us. I won't spend much time here on these deficiencies in the current laws. Bill Cox has mentioned them. They only cover certain funding avenues and certain programs. The only place you can go to enforce them for the most part is HHS, if they're part of the problem. You don't have a right to go to court, in other words. Hyde-Weldon, because it's written as an appropriations rider limiting funds, it says no federal funds can go to a government that does this discrimination, and that's probably so sweeping a penalty. It's like an all or nothing thing that people will be very hesitant to apply it, and people have even tried to bring lawsuits against that, saying it's an unconstitutional spending condition. And it may not even cover offices or agencies of a government when that particular office doesn't receive federal funds. That's one of the things the California Office of Managed Care said to our Catholic institutions as well. Well, our office doesn't receive federal funds, so we can do whatever we want, even though the state government does. So all these loopholes, which have solutions. The Protect Life Act, which would fix all the conscience problems in the Healthcare Reform Act itself, at least the ones related to abortion, and the abortion funding problems, that's already passed the House, stalled in the Senate. The No Taxpayer Funding for Abortion Act, which goes beyond this particular Healthcare Reform Act to cover every agency, foreign and domestic, in the federal government with a no abortion funding and protect conscience policy, that has passed the House of Representatives, stalled in the Senate. The Abortion Non-Discrimination Act, which would fix the problems in the Hyde-Weldon Amendment in particular on discrimination on the basis of abortion. That one hasn't passed in either house at this point. And the Respectful Rights of Conscience Act, which would fix the problems in the Healthcare Reform Act to go beyond abortion. And so you can't implement mandates under this law that violate people's religious beliefs and moral convictions. And that received 48 votes in the Senate when it needed 50 a few weeks ago. We have more than a majority in the House as co-sponsors of this. But there's a lot of debate now on what actual language to put into place so that you might be able to get a positive vote, a majority vote in the Senate, and pass something forward to put it on the President's desk. So what to do? Urge, in the immediate future, urge Congress to pass the Rights of Conscience Act, which the prime sponsor of the House, Congressman Fortenberry, I'm sure will be talking about with us this evening at the banquet. Submit public comments to HHS about its latest version of its rule. It's giving a 90-day comment period for this, and we'll be giving pointers on that and giving an easy way to go straight to that website and comment to HHS between now and June 19th on our conscience page. And of course, join the public debate. This whole debate, as Bill mentioned, has been framed as a face-off between the rights, the freedom, the health care, the health status of women versus the institutional rights of the church. We know that's not the issue. We know there are many, many Catholic individuals who are appalled at this as well. And we know that contraception is no medical cure-all for anything either. In fact, poses some very serious medical problems. One thing that we in the Bishops' Conference are going to do is pursue litigation on this. And when that litigation happens in the weeks to come, we'll be needing amicus briefs from men and women who object to being forced to have this in their coverage, from medical experts who are willing to say contraception is not the kind of thing to mandate as though it were a basic aid to women's health. And and from a wide variety of people with expertise that can help with this. So I'm hoping that some of you will consider that when these lawsuits come forward. One thing that is, I just want to mention in passing because it's particularly remarkable. When President Obama came out with his announcement in February about what he's going to be doing on this, he and his staff all said, if you are not actually exempt, you don't fulfill this very narrow religious exemption, but you have a religious objection, we will have the insurer offer the coverage instead to your employees. The new proposed rule makes it very clear that this is not an offer that you can refuse. Not to be applauded, Mike. They are actually going to automatically provide it to every employee of these religious organizations and all of their beneficiaries, their minor children, who of course will have confidentiality to access all this without their parents even knowing about it. So from becoming primarily an attack on the institutional rights of the church, it has become more explicitly an attack on all of us and our conscience rights as individuals. And if we're parents, our rights as parents as well. And it's thanks to Mike O'Day that I became aware of a 1995 document from the Guttmacher Institute, which originated as research on Planned Parenthood, saying, the reason why you want this nationally covered without a copay, without out-of-pocket expenses, this whole debate has been, oh, it's so expensive, and people pointing out you get $9 a month at Walmart and so on. It's not about that. It's not only about that. It's about making sure that minors can get it without having to go to their parents for the money. That's right. So that's what this has now become about. It's about going around the institution and getting to all of our people so that we become slaves of this mentality of Planned Parenthood. So thank you very much for coming and for being concerned about this issue. It's something we cannot fight unless we are united. Close with that.